Diagnosis according to Zhang Fu organ patterns. Stomach Qi Shu. Stomach Qi Shu. This pattern is very similar to spleen Qi Shu, both in its symptoms and its etiology. In fact, the two patterns often overlap and are commonly diagnosed together in clinical practice. Etiology: eating too much at a time, eating too little, eating too often, eating whilst working, or when stressed, or eating irregularly are all factors that can weaken stomach qi. Stomach qi will be debilitated by prolonged overwork and stress. Chronic illness will particularly enfeeble both stomach and spleen qi. Symptoms and signs would be fatigue, discomfort in the abdominal area, loose stools, bloating after meals, fatigue after meals, pale face, poor sense of taste, poor appetite or no appetite in the morning, weak limbs or tiredness of the limbs, craving for the sweet flavor, tendency to gain weight, disinclination to speak, and the voice lacks strength. The person looks tired and emanates weariness, slump posture, worries a lot or constantly speculates about things, pale, swollen tongue, possibly with teeth marks on the side, weak pulse, especially in the right one position. Key symptoms: fatigue, loose stools, pale tongue with teeth marked, and a weak guan pulse. Treatment principle: tonify stomach qi. Acupuncture points you may choose from: stomach 36, spleen 3, spleen 6, REN 12, UB20, and UB21. The needling technique should be a tonifying or moxa can be used. Explanation: stomach 36, spleen 3, spleen 6, REN 12, UB20, and UB21 tonify stomach qi. Relevant advice: the dietary change are alpha and omega in the treatment of stomach qi shu. It is important that the person focuses on what and particularly how they eat. They should eat enough food and not fast or go on diets where they do not consume sufficient food. At the same time, they should not eat too much at a time, as this will result in food stagnation. Constant snacking will also weaken the stomach qi. The patient should try to eat as calmly as possible. This means they should not eat whilst working or driving, when they are stressed or whilst they are doing something else. They should also ensure that they get enough rest and do not exert themselves after they have eaten. They should not eat too late at night. Walking around or lightly stretching the front of the body after eating will support the qi mechanism in the middle jiao and thereby support the stomach qi. The person will benefit from eating porridge in the morning, soups, mashed or pureed vegetables, stews, steamed or boiled vegetables. Example, easily digestible foods. The use of aromatic herbs in the diet will help to circulate qi and thereby help to prevent food stagnation. It is important that the person does not sit still for extended periods of time and they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial. Stroking downwards with the fingers from REN 16 to REN 8 will help support qi to descend. Stomach qi shu can be caused by the following pattern of imbalance. Spleen qi shu. Spleen qi shu can result in the following patterns of imbalance. Spleen qi shu, stomach yin shu, spleen yang shu, food stagnation, damp, phlegm, shui stagnation. Stomach qi deficiency. Etiology: diet lacking in nutrients. Example, proteins, excessive dieting, or chronic illnesses. The underlying and accompanying pathology are spleen qi deficiency. Signs and symptoms would be epigastric discomfort, which is better after food or with pressure. Poor appetite, preference for warm foods and drinks, no thirst, vomiting of clear fluid, cold and weak limbs, tiredness, pale complexion. The pulse would be empty, especially right middle position. The tongue would be pale. Treatment principle is to fortify the center and warm the stomach. Acupuncture treatments. stomach 36, bladder 21, pericardium 6, Ren 4, stomach 21, Ren 12, Ren 6, and bladder 20. Thank you for your attention.